All right, let's talk unhappy triad. The unhappy triad is an injury pattern that includes an ACL tear, the anterior cruciate ligament, an MCL tear, the medial collateral ligament, and the medial meniscus, this structure right here. You've all heard of ACL tear. It's one of the more severe injuries you can have in sports, and it's a common thing to happen as well. And the reason why it's seen as severe is because it requires surgery to return to a high level of sport, and it usually is going to take 8 to 12 months for a full, strong recovery that doesn't put the athlete at risk for early osteoarthritis and other issues later on in life. So with that said, why do these three things happen all the time? So I just want to be clear that ACL can happen by itself, medial meniscus can happen by itself, MCL can happen by itself, and all of these injuries can happen in different combinations. But the reason why this has a name is because a long time ago, a surgeon was seeing all of these coming in, and they were always commonly together. And so even though they can all happen in different ways, this is a very common injury presentation, and there's a reason for that. And the mechanism of injury for this, it can happen with direct contact. You can just get hit in the right direction. And if it's coming from the lateral side with some kind of anterior force that is causing this anterior translation on the femur, then that will cause that. But that is something we really can't prevent because we can't prevent direction, like a force coming from a certain direction. So what we focus on is the mechanism of injury in non-contact knee injuries, because that is a really hard thing to understand, why someone just running all by themselves in the middle of the field tears their ACL, MCL, and medial meniscus. But it's something that happens in sport. So a lot of people, including my husband and the CNS lab, are trying to better understand this and have prevention programs and a variety of different intervention programs to help treat this and intervene on it and prevent it and things like that. So what we do understand is that it's from a dynamic dynamic valgus collapse. And what that means is, when I say valgus, I mean there's an opening on the medial side. So the force is somehow coming from this lateral side. So remember, find the fibula, orient ourselves. From the lateral side, it will open up on the medial side and cause the MCL to tear. The MCL is so not only protecting the knee, but it's protecting this opening up. It's protecting the tibia and the femur from moving. And it's really strong. But because we commonly get hit on the outside of our leg due to having a leg on the inside protecting the medial side, this is a common mechanism and reason why the tibia and femur would translate. So the MCL is actually very strong, but it's very strong when we're in a 30-degree flex position. So when we're flexed like this. So if we're in an athletic stance where we're bent and we're like doing agility side to side or running or cutting, our knee's actually well protected. But when we get tired or we're just standing up and we're not like bent like that, and we're just standing straight up, that MCL is loose and it's not protecting. And so when we suddenly stop and we break, our knee just naturally moves this way. So our femur is going to naturally stay here. Our tibia is going to naturally move forward, and we're going to naturally have this valgus kind of force. So when the MCL is not taut and not able to protect itself and is not fully tightened, that's what I mean by taut, then it is going to just collapse on itself. When it collapses, it is going to then have this moment of like moving in on the MCL. The tibia is going to move anterior. So now the ACL tears, the MCL tears, and then the MCL is attached to the medial meniscus. Because the MCL is a C-shaped and it's also attached to the MCL, it doesn't move a lot, so it isn't able to absorb forces very well, so it also tears. So that's why you have this dynamic injury of all three things happening at once. It's hard to fully understand why this happens, but I think most researchers and clinicians will agree that this is a multifactorial problem, that it can be from any kind of muscle imbalance in the lower extremity. It can be from a power issue, like lacking power, lacking torque in like the quad versus a hamstring, or maybe the hamstring is overpowering the quad, or it could be an abductor adductor issue. It can also, they're looking at closely neuromuscular issues where the receptors in the joint and the ligaments, tendons, muscles aren't communicating back to the knee or back to the brain. So if there's ever been a knee injury there, they're more likely to have issues with that neuromuscular system. So what we have concluded is that doing baseline measures, so my husband does a LEAP program, and he's bringing it here to UCF, where they basically they put someone on a biodex, which is an isokinetic device, to look at power and torque, strength of the hamstrings and the quads. They also have them do landing mechanics, because landing mechanics can really tell us if we have the ability to brake and stop and move and change directions appropriately, and if we have the muscle ability and function to do that. So what we're learning is that, especially people who are women's soccer who are at high risk for this, we have them tested first so we can get baseline measures. We can also identify anyone who's at risk, who has power issues, torque issues, functional issues, poor landing mechanics. We can intervene on that and then put them at less risk for injury. So this is a very complicated injury, but this is a common thing. So understanding that the unhappy triad includes the ACL, the MCL, and the medial meniscus due to that dynamic valgus collapse from a non-contact knee injury, and that it is multifactorial, but it's likely to be due to muscle imbalances of some kind, and then some kind of neuromuscular function issue. So if you have any questions or if this is still confusing, please rewatch and then reach out to me.